Hello everyone and welcome back to Easy Dentistry. Today we are back with a very important topic, that is malignant fibrous histiocytomas. This is a very important question which is asked in your exam. So let's study this tumor. But before we begin, please subscribe to our channel and also put on the notification bell. So malignant fibrous histiocytoma or MFH was first described in 1964 as the malignant fibrous xanthoma. It is the most common sarcomas of the adults. The oral and maxillofacial sites are seldom involved. However, the tumor mostly occurs in the soft tissues of the extremities and the retroperitoneum. Now, the clinical features of malignant fibrous histiocytoma, it occurs mostly in adults in the age range of 50 to 70 years. The males are affected twice than the females. The oral sites are relatively rare. Then in oral cavity, it appears as a firm submucosal mass which is slow growing, or sometimes it has moderately fast rate of growth, and it may present with pain and superficial ulceration. The nodular lesion of malignant fibrous histiocytoma is typically unencapsulated and it is attached to the surrounding tissues and attached structures. The lesion is less than 4 cm in its size. The myxoid variant of malignant fibrous histiocytoma is softer in consistency, while the engematoid variant is more superficial lesion, while the other variants are deeper lesions. So this is a picture showing malignant fibrous histiocytoma in the intraoral site. Now the histologic features, this part is very important, so watch it carefully. There is a wide spectrum of cellular and tissue alteration in malignant fibrous histiocytoma. The cellular differentiation and density vary markedly even within the same tumor. The classic feature of malignant fibrous histiocytoma is the storiform or the cartwheel pattern of streaming spindle cells. The head and neck sites tumor show the characteristic storiform pleomorphic malignant fibrous histiocytoma. So what is this storiform or the cartwheel pattern? So here you can see the storiform or the cartwheel pattern. The word storiform means whorled appearance. So here you can see the whorled appearance of the cells, and it also resembles the cartwheel, the wheel of a cart. So this is the storiform or the cartwheel pattern of cells in malignant fibrous histiocytoma, which is also the characteristic feature of malignant fibrous histiocytoma. The cells may show mild cellular and nuclear pleomorphism. There are two types of cells present, the fibroblast-like cells and the histiocyte-like cells. Now, the spindle-shaped fibroblast-like cells show woven fascicles or bundles. They are long, thin cells with minimal atypia. Sometimes the fibroblast-like cells may be plump with hyperchromatic nuclei. So here you can see more of the whorled appearance or the cartwheel pattern of these fibroblast-like cells. Now, the histiocyte-like cells are rounded, polygonal or irregularly shaped with eosinophilic cytoplasm and foamy nucleus, and these cells are haphazardly arranged. So here you can see under higher magnification the spindle-shaped fibroblast cells with the characteristic nuclear atypia and hyperchromatism, while here you can see few more cells with foamy cytoplasm. These are the histiocyte-like cells and these are the fibroblast-like cells. Also, you can see chronic inflammatory cell infiltration scattered sparsely throughout the tumor, which include the foamy histiocytes, lymphocytes and plasma cells. Then the fibrous stroma of malignant fibrous histiocytoma varies in density, being less pronounced in areas of lesser cellular differentiation. The myxoid stroma may be found with rarely foci of osteoid or cartilage metaplasia. Now, dilated blood vessels are also seen in the stroma. The malignant fibrous histiocytoma is currently subclassified as one of the several major variants. So, these are the subclassification of malignant fibrous histiocytoma. The pleomorphic storiform pattern, which is most common in the oral lesions, then the myxoid pattern, angiomatoid pattern, and the giant cell pattern. Now, the treatment and prognosis of the tumor, the radical surgical resection is recommended. There is 40% rate of recurrence of this tumor, the local recurrence, and there is increased rate of metastasis. The 5-year survival rate of the patient is less than 3%. So here we complete with the discussion on malignant fibrous histiocytoma. The next lecture will be on synovial sarcoma. That's all for now. Happy studying.